Welcome to the Age Friendly Through an Equity Lens webinar. So everyone's joining. We'll just give folks a few minutes to get settled. Welcome everyone. My name is Jody Muka with BC Healthy Communities. We're just getting started, getting organized for the webinar. And as you're joining, if you would like to introduce yourselves and connect with each other in our chat box, you have a few minutes to do that now. And we'll get started in just a couple of minutes. Great, we've got folks still joining. So this webinar today is part of the age-friendly community capacity building supports that BC Healthy Communities is providing to Abbotsford for your age-friendly community planning process. And it's delivered by myself, Jody Muka, and my colleague, Sarah Dyer. Again, I see there's still a few people joining, so let's take another minute and then begin the webinar. And this webinar today it's a closed webinar, and it's specifically for those of you that are part of the Abbotsford community of integrated practice, specifically to support you in your age-friendly planning. And as I said, there's the chat box. So if you'd like to introduce yourself, some notes, I see folks are joining and adding some comments in there. Okay. Just a couple more minutes. And I'm assuming that you're all calling in from Abbotsford. If not, you may want to add the territory of where you're joining us from today. I think you all know each other from previous work and meetings as part of your integrated community of practice, but if not, definitely feel free to add some comments in there so you can get to know each other a little bit more. It's great, some comments in there. Awesome. All right. So we may have a few folks joining us as we get into the webinar, but I'm going to start today so we can make sure that we have enough time for questions and answers at the end. So thank you so much for joining us today. As I said, this webinar is developed specifically to support you in your age-friendly planning work in Abbotsford around the aging well, older adults, and the link to homelessness. And myself and Sarah Dyer, my colleague, are presenting this webinar to you. We have some of our staff joining us as well, and they're managing our chat box and the questions and answers. And I'll just provide you with a quick housekeeping list and tips and tricks. So again, this webinar is an exclusive webinar to those of you as part of this Abbotsford integrated community of practice. We are recording it, and it will be made available to you after the webinar. And there's resources that we're speaking to as well that we'll be speaking to and that we will provide as complimentary, what do you call it, subsequent resources to support your work. And I'm assuming that everyone's pretty well versed in Zoom at this point in time. So we have the chat function where you can chat. And if you have some specific questions that you would like us to draw from at the end of the webinar, please post your questions in the Q&A down at the bottom. And we've got someone on staff that's monitoring those, and we'll bring forward some of those questions at the end when we have time allocated to cover those. And then if there's any technical questions, definitely post those in the chat. We have someone on standby to support you if you have any technical challenges as well. All right, so if we can go to the next slide, we'll start off with some introductions. And next slide. Now, I'm Jody Muka, Executive Director of BC Healthy Communities. I've been with the organization since 2005, and I must admit that I have a soft spot in my heart specifically for any of the work that we do that is related to seniors, older adults, and age-friendly communities. My Grammy lived until she was in her mid-90s, and you know, as a youngster growing up with her and being close to her, I really value that connection and have always been thinking about some of the things that she's told me about, you know, challenges as she was aging and seeing it firsthand. So that's a little bit about myself and my colleague, Sarah Dyer. She's our community well-being and age-friendly specialist. And she's the lead on our BC Healthy Communities team who oversees the age-friendly portfolio. And she's our team lead working specifically to support you in Abbotsford with your age-friendly planning. And next slide, please. And also our central office is located in Victoria. We've all been working remotely. We're working from our home offices in Victoria at this point in time. And we are on the unceded territories of the Lekwungen people, and otherwise known as Songhees and Esquimalt First Nations. And, you know, doing this acknowledgement is just, it's merely scratching the surface. We know that we have definitely, our colonial system and framework that we operate under has definitely contributed to the many inequities that we see in communities across BC, and specifically for First Nations communities and Indigenous peoples. So we know that there's a lot more that we can do. And as we move forward as an organization, we are really looking at what we can do in terms of our reconciliation efforts and applying that equity lens across all of our work to, you know, better understand, support, work with, and just reconcile the you know, issues that we're faced with in our communities. So next slide, please. So quickly, a little bit about BC Healthy Communities. So as I said, we've been around since 2005. We're a not-for-profit organization, and we work at the provincial level. And our work is really at that intersection of planning and public health. And it's a multi-sectoral approach. Our team is made up of community engagement experts, public health professionals, community planners, and it's a very interdisciplinary approach. We are based on the World Health Organization's Healthy Communities approach, and critical to that approach are the success factors for any Healthy Communities initiative. And first and foremost, it's taking a multi-sectoral approach. So the work that we do across the province is all about collaborating across sectors and trying to bridge that gap between the various different sectors so that we're not working in a siloed approach or a way, but that we're really taking a more integrated and collective impact to our work across the determinants of health and across all of those community issues that we're dealing with. Next slide, please. So we offer a range of programs, resources, and fee-for-service offerings. One of our programs specifically is age-friendly capacity building. And that program we have been involved with since 2011. The funding comes from the Ministry of Health through a partnership that we've had with them since that time. And we've delivered the Age-Friendly Recognition Award, and we've been providing age-friendly capacity supports to those communities who have received age-friendly community grants from the Union of BC Municipalities. And our work is to develop customized services, supports, planning processes, coaching supports for communities who are embarking on their age-friendly community planning process. And really fundamental to all of our work, and especially the age-friendly work, is applying an equity lens. And we're thrilled today to be speaking to you about, what exactly is a health equity lens? What does it look like? How you can apply it to your work, and what it looks specifically like around older adults, seniors, age-friendly, and homelessness. So next slide. Thank you. All right, so that's all the nuts and bolts. So we're going to get right into the content of the webinar today. And again, it's age-friendly through a health equity lens. And if you could please advance next slide, we're going to get right into it. Okay, so the purpose today, this was tailored with the lead in Abbotsford for this initiative. And really our goal today is to increase your knowledge and awareness of health equity and how it applies to the work that you're doing to support planning for older adults and the aging journey. And it's really building on your capacity to then use an equity lens in your work. And for those of you that are on this webinar with that increased understanding, awareness, and ability to use that lens, you then being able to take that out to your colleagues, partner organizations, and other stakeholders, so that you're sharing that and you're contributing towards building the capacity of those folks, so that overall we're all taking it up a level and really moving forward in all of our efforts from that equity perspective. And our agenda today is on the next slide. So I'm going to spend a few minutes really laying the foundation. What is health equity, and speaking to what an equity lens is. And then I'm going to hand it over to Sarah, and she's going to speak more specifically to what that means for you in your work in Abbotsford, and what that looks like in terms of working on planning strategies to support older adults and age-friendly, and also from that perspective of homeless conditions and complex challenges. And then at the end, we're allocating some time to take questions and have a bit more of a discussion. So without further ado, we're going to get right into what is health equity. Many of you, this may not be a new concept. It may be something that you've heard of and you don't know a lot about. So again, it's a bit of a broad brushstroke to lay the foundation for the conversation that Sarah will be having with you. But really, health equity is when all people can thrive, and when all people have access to conditions that allow them to thrive. And one of the things that's important is that people are not disadvantaged from attaining it. And that's where we look at some of the things that are inhibitors are race, or when we think of the barriers, it's often because of race, ethnicity, religion, gender, age, social class, loosely categorized as racism, and the systems and structures that we work within. So there's a medical health officer that's well known and a health equity advocate in the US known as Camara Jones. And very simply put, her description of health equity is the assurance of conditions for optimal health for all people. And when we talk about assurance, it's about the process and not an outcome. Meaning there is no endpoint. It's something that we have to be continually looking at. We have to be continually challenging the systems and the structures that we're working within, and constantly looking and asking the right questions. So process versus an outcome. Next slide, please. Thanks. So you may have seen there's a variety of different images out there that depict the difference between equity and equality. So this is really a way to help us understand the difference if we compare the two. So if you think about the uneven ground, the uneven ground really represents the systems and the structures that we work within and that are outside of the control of the individual. And it's something that can be changed, but not at the individual level. So the uneven ground are the systems and structures that we're working within. And if you look at the image on the left, we have uneven ground and everyone receives the same size box to step up and pick the fruit. And as you can see, coming from that standpoint of equality, everyone getting the same box does not necessarily meet the needs of all people and thus supporting optimal health for all. And then if you look on the right, if we look from an equity standpoint, there's uneven ground, which is the systems and structures that we work within. But if we look at providing the resources and opportunities that will meet the needs of individuals or meet the needs of communities or populations, the size of the box or the size of this step up, which is the resources and the opportunities, it looks different. And it's really about meeting them where they're at so that they have the opportunity and thus can achieve the optimal health conditions for all. Oh, next slide. So that brings us to health inequities. So, and actually just before I move ahead, another really great analogy, way of thinking about equity. There's a feminist in Southern Australia who's well known for the social work that she does. And her analogy is that equality is where everyone gets a shoe. Equity is everyone gets a shoe that fits. And I just love that. It's a very simple analogy, but I think describes it quite well. So in terms of health inequities, so I think the thing that's really important to note here is that the inequity is actually caused by the differences in the access to the opportunities. It has nothing to do with the inherent difference between individuals. So again, if we think about the access to the opportunities, access to the resources, that again is largely due to the systems and structures that have been designed and in some ways are deliberately so without us necessarily intentionally knowing that. And this is connected to the social determinants of health. So the social determinants of health, they're conditions in which, we're born, we live, we work, we play in. And those are all the things that influence our health. So the social determinants of health inequities are the conditions and the structures and the processes that distribute them unequally in society. And what this does is it in turn, it creates unfair disadvantages while also creating unfair advantages. And so at the individual, at the community, and at the population level. And so health inequities show up as avoidable health disparities. And they're the health differences between population groups that exist in health status and health outcomes. And again, it's due to the underlying factors. We think of social, economic factors that largely contribute to the health inequities, and specific to the work that we're talking about that you're doing in Abbotsford right now around older adults and experiencing homelessness. And the reason we're focusing on the systems and the structures is because we can actually influence change versus it being about the individuals. And again, it's avoidable, which is the good news because it means that we can actually go to work and do something to influence change in that area. Next slide, please. So using a health equity lens or an equity lens. An equity lens is really, it's a set of questions that are used as a tool to allow you to be deliberately inclusive throughout all the phases of your planning processes, from your planning, engagement, policy development, and even your evaluation. And so you want to think about it as a continuous feedback loop. So you're always looking for, what are we missing here? Who's being left out? And so if we can go to the next slide, there's five key questions that can be used as a lens, as at least as a starting point. And as I said, they can be used through all phases of your planning initiative and evaluation processes. So who is it that's benefiting from this initiative, policy, program, or even some procedures that you may be putting into place? And who is it that's excluded? Who's missing? And what is it that's actually contributing to this exclusion? What is it that we might do differently to ensure inclusion? And then have the important decisions been made with direct input from those most affected? So especially in this case, and in all cases really, is looking for those people who have lived experience around the specific issue that you're trying to address and ensuring that they're at the table. And again, this is also the value of taking that multi-sectoral approach, which I was sharing as a pillar of the healthy communities approach. It allows you to get the input from all sectors and from all variety of perspectives so that you're reducing a siloed approach. And then again, when you are looking at the success of your initiative, it's a really valuable question to be asking: success based on whose perspective? And would success look different from a variety of different perspectives? Next slide, please. And there's also a really great resource that we drew from when we were looking at some of these questions around an equity lens. One of which is actually out of Fraser Health, which is really valuable, and it'll be shared with you at the end. Some of you may be familiar with it. It's the tool is called the Community Planning Tool, Applying a Health Equity Lens to Program Planning. And again, that's something that was produced by Fraser Health, and we'll share the link in that resource with these materials after the webinar. And so at this point, that's kind of the basic broad brushstroke overview of health equity and an equity lens. And I'm now going to hand it over to my colleague, Sarah, so she can get right into what this means for you in Abbotsford and specifically around your age-friendly work. So over to you, Sarah.
Thanks, Jody. That's a great section on health equity. Thank you. Okay, so the factors that affect health equity, Jody touched on at the beginning when she was defining that term. And it's the factors that affect it are the social determinants of health. And this list here, and Jody identified the more familiar ones earlier on. So these are the environmental conditions in which we live our lives. So to highlight that point and what that means, where we're born, where we grow and learn, play and work, and grow older. And so the thing is, contrary to popular belief, the lifestyle choices that we make are actually determine a very small portion of our health in comparison to these social determinants of health. So they actually affect more like 75% of our health outcomes. This includes physical, social, and mental health and well-being, and they're strongly affected by, and they strongly affect our health. So, for example, again, social factors like gender, race, employment, working conditions, income, and so on, housing, and all of these on the list and more affect our health and well-being. It's really important to be aware of the fact that these factors are affect our health so strongly and are beyond our control. So that is a really huge point, that these things that affect our health the most are out of our control. Um, so while the social determinants of health are complex and intersect with each other, applying an equity lens to policy and program planning can improve social determinants of health, and then in the end help reduce health inequities, sorry. Um, this actually brings us to a quick note on the next slide of intersectionality. So the main thing, this can be a complex, long on topic on its own, but the main thing here is that no one falls under one group only. No one falls under only being female or male. There's so many other factors that overlap and layer with each other, as this diagram suggests, or this image. And so it's basically to remember people fall under more than one group. So taking this into consideration, and this is called intersectionality. Before we go on to the next slide, I wanted to just give an example to think about as food for thought. We won't get into a discussion or anything, but just considering the difference in the two descriptions that I'm going to just share with you verbally, and the impact that those descriptions might have on the questions you would ask or actions you might want to take to support someone. So the first one would be, here's an example. First description, you receive information about a woman who's 55 years old, 55 plus years old. It's not really specified beyond that. And she's experiencing homelessness. Second description, you receive information about a person who's single, 67 years old, a single woman who's 67 years old, Indigenous descent, living with a disability, and is experiencing homelessness. So just an idea to illustrate the difference of thinking about intersectionality. So again, we won't discuss it, but it was something to mull around in your brain while we continue on with this presentation. Okay, so thank you. Next slide. So in age-friendly communities, applying an equity lens is just the same. What Jody brought up about simply asking yourself questions throughout the process, right from the very beginning all the way through, about who's included, who's not, who's missing, why, what can we do to increase inclusivity of that group or others, who's benefiting and who's not, and so on. So going into the next slide, just touching on why using a health equity lens is important in age-friendly planning beyond, I mean, it becomes apparent from those questions, but specifically older adults are heterogeneous and complex groups. So they're diverse and complex like any other group in the lifespan. It's starting to change now. I think it's more, it's becoming more practice to consider this, but it's not just only about considering age, but all of those groups that are also in all the other lifespan ages in the lifespan are also in this group, and they need to be considered and included. Also thinking about when we were talking about age, that chronological age is actually only very loosely correlated with biological age. So really those of the same age can show dramatic differences in their physical and mental health. So aside from the other level of diversity, there's this one as well. No one is the same at any same age, really. Okay, so the third point here is identifying stakeholders. And so the equity lens helps us to do that. And, oh, I think I skipped a point. Sorry. In considering the disparities in lived experience with older adults, actually, this is talking about where existing vulnerabilities that people may have are intersecting with aging. So not only are they dealing with the challenges of aging, now existing things that maybe mobility issues that they had already are now amplified, or other vulnerabilities to do with any of those social determinants of health, could be gender, race, etc. As we've been saying, those things. So those get amplified in with older age as well as aging continues. So the equity lens considers these disparities and helps bring, again, these diverse groups in to have their voices heard. Okay, so back to identifying key stakeholders. This also, again, Jody mentioned those with lived experience. So this part of using an equity lens helps you reveal who are your key stakeholders, and often, so it's important to think of and realize that your target group is pretty much always one of your key stakeholders. So rather than only thinking of them as the people that you want to engage and perhaps do a survey with, or whatever your means of engagement is, they also are context experts with their lived experience. And if you bring them in from the beginning, bring them to planning tables and to decision making tables, that's when you can get some real innovation and new ideas, instead of keeping the same things happening when we don't do things differently. And so bringing them to the decision tables and planning tables is key in that group, as well as, of course, engaging down, in the engagement segment. And then the other one, number 4, is really to highlight the point that age-friendly communities benefit everyone, and equity does as well. And you know, using an equity lens helps to address inequities, ensuring inclusion of all voices from the beginning and throughout. And this leads to the development of more responsive and sustainable programs and policies and services. And everyone benefits. And I want to just share on the next slide, there's a little quote, but there's an example and the links on the slide, which you will get these slides after the webinar in the next day or two, and they'll be posted on Abbotsford City website. But anyway, at this link, so there is the curb effect is a great illustration of where policies and programs were designed for underrepresented groups and ended up benefiting all. So this one is where these curb cuts in the curbs, where you cross the street, were put in place and in response to advocacy efforts of people using wheelchairs. And this was in Berkeley, California in the 70s, I think. Many other community members benefited and were using it like crazy, like those pulling suitcases, pushing strollers, cyclists, and many others. So that was unexpected then, but that just shows how it benefits. One little example of how it can benefit everyone. Okay, so we can move on to the next slide, thanks. So now I'm going to move the conversation on to, as we talked about, to the underrepresented adults, and specifically those experiencing homelessness. So bringing the health equity lens conversation to that. And I'm going to just start with a definition that's 2-part, and it's a great definition because, in my opinion, because it, in the second part, also includes the reasons, the systemic reasons that we were talking about here that are lead to the homelessness situation. So I'll get to that in a minute. So homelessness is the situation of an individual, family, or community without stable, safe, permanent, appropriate housing, or the immediate prospect or means and ability of acquiring it. This is from the Canadian Observatory on Homelessness. It's at the bottom there. We can go on to the next slide. Okay, so in this one, it's saying that the homelessness is the result of systematic or societal barriers, a lack of affordable and I thought I was reading the wrong thing. I'm sorry. Okay. A lack of affordable, appropriate housing, and individual households financial, mental, cognitive, behavioral, or physical challenges, and or racism and discrimination. So those are the social the social determinants of health aspect that we're talking about. Okay, so we can go on to the next slide. With this, I am going to just start with talking about, in a brief way, the challenges that have been there so far in addressing health and homelessness, and some of the things that are starting to change. So the first one is gaps in the understanding of homelessness in older adults. We can go to the next slide. Okay, so the gaps in this understanding are really related to minimal data on older people experiencing homelessness. This is starting to change. Abbotsford, for example, has been including data on older adults in the homelessness population, which I'll touch on in a minute. But generally, the literature in Canada can overlook certain underserved subgroups in the older adult population, like those, like including in the discussion, the intersection of homelessness with aging. And that just leaves it a lack of understanding of what can another aspect that needs to be considered in the aging of aging of adults. Also, a challenge is the invisible or slash hidden homeless population, which is there are people who are staying temporarily with another household when they don't have their own, and their own regular address where they can stay if they have indeed access to that kind of social support. So basically, these situations can make it challenging to know, how many older, it's hard to really get a true number of this population, but to get a true idea of how many older adults are experiencing homelessness, and because it is growing along with the older adult population in general is growing. Also, what is their demographic profile? That's not really clearly known, and just generally to understand the possible needs of this group. Okay, we can go to the next slide. Did I already skip? Okay. I'm just double checking. Okay, so this slide is the challenges in the slide gap number 2, gaps in initiatives, which is where initiatives can tend to have less of a focus on older adults, homelessness, experiencing homelessness in the strategies. They tend to focus on the groups that we know really well are associated with this, like youth, women, Indigenous people, and members of LGBTQ communities, but there is less of a focus on the subpopulation of people age 50 plus. And that's because probably maybe it hasn't been increasing like it is now. So this gap does leave decision makers and practitioners with no real direction on what the needs are of older adults experiencing homelessness or how to respond to them. Okay, we can go on to the next slide. Thanks. So to give some context locally before moving on, I wanted to share some information on Abbotsford with data made available by HelpSeeker, who's working with Abbotsford on the age-friendly assessment for this year. And looking at the older population, it is growing in Abbotsford as well as other places. So the census data from 2016, we can see that people who are 65 years of age or older, that population in Abbotsford has gone up, while those who are 19 years of age and younger is going down. So the gap is increasing there in between older and younger. Also, those aged 50 or more years old are over 1/3 of Abbotsford population. So again, it's growing. Those 65 and older are 17% of the population. We can go to the next slide. So in the context of homelessness in Abbotsford, they've been counting, there are things called point in time counts, which are PIT. These are done every 3 years by Fraser Valley and other regions. And for the Abbotsford region, there was a count of 333 people experiencing homelessness. So this was done, like I said, in March 2020. And what it is it's a snapshot in time of what the picture of homelessness might look like in terms of numbers of people, and in a 24-hour period. So this was between March 3rd and 4th. Okay, so of those 333 people at that time, there were 31% were 45 years and older. And I'll get to this in a bit, not too long actually, but in this population, 45 and older is considered older adults, and for reasons we'll get for aging is more advanced or quicker in this people living with much harder life. So right now, over 30% are considered older adults in the homeless group in Abbotsford. So on here, there's actually saying within this group, 51% were 55 years of age and older. It's actually a little bit of not reported completely correctly there. That's my fault. It was when seniors who were defined as 65 plus, who are defined as 65 plus, so 45 to 64 is older adults, 65 and older are seniors. Then those who are over 55 years of age make up 51% of this group of older adults. We call them, just to clarify, it's a little confusing, we call people who are, instead of using the word seniors, we use the word older adults, because a lot of talk with a lot of seniors, it makes it pretty clear that pretty much no one, no matter what their age is, likes the term. So it's slowly kind of being converted. I've seen we use older adults. I've seen a lot in literature, older people. So just kind of clarifying that, which might be a little confusing here. Okay, so on to the next slide. This is what so that was kind of what the challenges are, what we may not really know very well, aside from Abbotsford starting to collect more data and really identify older adults in their population of homelessness than has been done in general. Okay, so evidence does show what we know so far. Earlier, I mentioned that there, gaps in what can make it challenging to address health and homelessness. So these ones can maybe make some things a little more clear. So with older in the context of homelessness, older adults in the context of homelessness is actually a chronologically younger age than those who are housed. And also considering this, that, perhaps age is not the best indicator of need for support. So for example, supports that are available to people who are 65 years plus in this group, perhaps it needs to be made available to those who are younger because they are in need of that. And again, in Abbotsford, they look at those who are 20 years younger than that. So it's kind of an important point. Okay, I think I may have missed moving on to a slide or two. Can you go forward, please? Yeah, in the next one. Thank you. Okay, so the other thing that's been emerged in the research is that on pathways to homelessness for older adults. So if we go on to, I think we can stay on this slide. I don't think I broke it down on the next one. So as with other groups mentioned in the second portion of the homelessness definition that we provided earlier, some of the determinants of health that come up in this context are physical and mental health and poverty. So these are more, while there's similar pathways to all of, as other groups in older adults, these have been identified as cited as pathways. So with physical and mental health, just wanted to mention that the relationship between homelessness and health are complex, or the relationships are complex, and homelessness can both be a cause of ill health and a result of ill health. So it can go either way. Poverty, so this is referring to unaffordable housing and low income, which are cited as primary pathways. So low or no pension contributions can be the culprit here for those over 65. Those that, for example, didn't work in the formal workforce, which often can be women, so they didn't get benefits. Barriers to continuing employment, like ageism and discrimination in general. So all of this meaning older people from disadvantaged groups often become homeless for the first time later in life. There are those who are growing older while living in homeless, but this is people who are in their 45, 50, 55 becoming homeless for the first time. Okay, we can get to the next section. Okay, so I'm going to talk about two key determinants of health for health and homelessness, relating to homelessness. So housing and access to healthcare. For housing, you can go to the next slide, please. So housing is actually, it's not just about shelter over one's head. It affects our ability to gain employment and access to healthcare, among many other items to point out. But healthy housing is affordable, appropriate, accessible, and of good quality. And healthy housing leads to reductions in things like illness and preventative injuries, for example, and it can positively contributes to our health. So on to the next slide for the next factor. Affecting health equity in older adults living in homelessness is access to healthcare. To begin with, health services are a determinant of health, and the health system has a responsibility to pursue health equity. Thinking about how patients and families can experience difficulty in accessing health services because of things like transportation, language, or cultural differences. If we look at people experiencing homelessness, they may not be able to even get medical treatment without an address or a health card. And if they are able to get treatment, they may not have anywhere appropriate or anywhere to properly recuperate. Also, they may not be able to afford the medications that are prescribed. So in this population, we really need to move from emergency care to healthcare and preventative healthcare. So bottom line, for a health system to be equitable, the services need to be available, accessible, and acceptable to everyone in the community. Okay, so before I go on, and Jody's going to be talking about some solutions or actions that you can take, I wanted to just finish for this section with, the bottom line is that, and Jody touched on all this at the beginning. So the bottom line is that using an equity lens requires an acknowledgement that systemic and historical discrimination has resulted in the uneven distribution of resources and power and opportunity, which in turn has created underserved and underrepresented communities who face greater barriers to health and well-being. So it's these systemic factors that need to be addressed through programs, services, and policies to improve the health of underrepresented groups and their quality of life. And this is the important work that you're already doing in Abbotsford with your age-friendly initiative. And I know there's a lot of integration going on in Abbotsford, and this will impact some of the systemic factors at the policy level and the program and service level as well. And it will impact health equity in Abbotsford in the underserved groups of older adults. Okay, it's on to you now, Jody, to finish up.
Thanks, Sarah. All right, yeah, if we can go on to the next slide, please. So in terms of actions that you can take, we really need to take a multi-pronged approach. So these complex community issues that we're dealing with are what are known as wicked issues and need a variety of responses to address them. And that takes different time frames as well. And I think what we really need to do is look at what are the actions that can be taken in the short term to see some quick wins. And then what are the things that we need to go to work on and address on a consistent, regular basis over the longer term. And before we can get a lot of traction and really influence change, one of the number one things that we need to do is think about system change that's required. And we touched on this, I touched on this a little bit at the beginning when I was speaking about equity and some of the inequities. And first and foremost, it's looking at recognizing and acknowledging, and then going to work on dismantling the racism that exists within the various systems and structures that we work within, which are the fundamental barriers to all people having those conditions, having opportunities for those conditions, and the resources for those to have optimal health. And again, we spoke about the different individuals, populations, communities that experience those, the discrimination and the barriers that makes them disadvantaged. So first, we need to look within our own organizations to see where that may exist and what we can do better, and applying an equity lens to our own organizational practices and policies. And then look at how we may be able to get involved in influencing change at then the local level, the local municipal level, and even beyond. So that's one thing, is that broader context, and the system that we work within is fundamentally the thing that is the barrier. And then at the community level, what you can do, many of the things that Sarah touched on, is first and foremost is engaging with and ensuring that you're hearing from those with lived experience, and you're designing forward based on what's going to meet their needs. And then the next thing is, there is no one size fits all. So, I mean, especially with homelessness, and I think the reason there's challenges to address homelessness is there's often been at a provincial level an approach to address homelessness as if it's a across the board issue, instead of looking at the variety of people that are experiencing homelessness, for what periods of time and for what reason. So there is no one size fits all. And as part of that, fundamental to that is also much of what impacts health and health care are all of those players, stakeholders, the local actors at the community level that are working outside of the healthcare system. So again, hence fundamental to a healthy communities approach, and success factors for that kind of work, is taking a multi-sectoral approach. And I think there's, as Sarah mentioned, there's really good examples of what you're already doing in Abbotsford that demonstrates that, and that demonstrates that very integrated approach with your healthcare services and the various different programs that you're delivering. So, you're definitely on the right track and demonstrating great initiatives and approaches in that regard. And again, as we talked about, is applying an equity lens every step of the way, and like never letting up, continually asking those questions. It's kind of no stone unturned, so that you are looking from that perspective, but you're also building the awareness and the capacity to see from that lens through your stakeholders, through your partners. And then hopefully there's also that ripple effect to those, at the provincial level. And hence we're starting to impact the perspectives of all of us involved in how we view the various different ways we go about addressing these issues, but then the systems again that we're working within. And addressing the multiple kinds of abuse, as Sarah said, physical, sexual, financial. There's a lot of challenges from that determinants of health perspective that are experienced by older adults that have found themselves homeless. And I guess the other thing too is the first point on this slide is, and Sarah touched on this, it's thinking about, rather than thinking about categories of age and categories of those within a certain age group experiencing homelessness, you need to think about, when you're creating programs, when you're leveraging funding, or when you're allocating funding to address these issues, is thinking about it from the perspective of the need versus getting stuck on these different categories of age. So those are a few things. And again, we've got resources that will share some more specific examples of other communities, such as Kelowna in particular, that has embarked on some strategies similar to this that we will share with you. And I don't know, Sarah, if you have anything else to add to this list. You're a little bit more in the work in Abbotsford, but feel free to jump in here, and otherwise I'll hand it back to you.
Thanks, Jody. No, I think you did a very comprehensive summary there, or conversation there. Thank you. Yeah, so we've got 5 minutes left in the webinar. So I saw that there was one question in the chat, and I just answered it already. But Just want to double check Q&A, see if there are any more. I didn't see any more. I don't know if anyone has any other questions, or if there are any in the chat that I may have missed, but I don't think so. We have our Claire definitely being on top of that. But if there are more questions, what I'm going to do is go on to my summary here of just what we're going to, next steps in terms of the resources we're going to share. But if there are more questions while I'm talking, please feel free to pop them in there. And in the meantime, I just want to thank everyone for participating today. And I hope that there was some useful information in here for you. Like Jody mentioned at the beginning, we were taking a high level approach, even though it kind of was jam-packed anyway. It definitely a high level approach. You can really go so deep in this because, trying to address kind of the whole range of possible awareness of this, of equity and an equity lens and health equity in this group. But we really appreciate you participating today. So as Judy mentioned, so we have put together, when we were developing the content of this, there were definite resources that we felt would be so useful for people, and they're just really easy to use, or just had the right kind of information that, that was easy to kind of just user-friendly, I guess. And also we collected them for the different components of what we spoke about. And then we put them together in this resource that is like 4 pages, but single-sided, I believe. And it's categorized by social determinants of health and so on, and equity lens, and different applying an equity lens within organization or at the community, local government level, different scenarios. So it can really be, people can pick and choose. And we put a little description before the links. So the links are there, they're live in the PDF that will be posted. I'll get to that in a minute. So those little descriptions, so you don't have to go clicking on every link to find out what something's about. You can just read the description and see if it's something that interests you. Hopefully, I think our goal is to make that user-friendly as well, and very simple and not overwhelming. So we will be sharing that, and we will be sharing at a few days after, a day or two after the webinar, we will be sharing these slides with talking notes, all in PDF, as well as a link to the webinar recording. And those are all going to go on the City of Abbotsford's website in the Community of Integrated Practice section, under the resources section. But you'll get an email from us at BC Healthy Communities, maybe tomorrow, by the end of the day tomorrow, about all the next steps and follow up with that, where you can find those things, what's there, so you don't have to worry about writing it down now. Yeah, so if anyone has any questions about that, feel free to pop it in the chat, but you'll get information tomorrow at some point. The other thing I want to mention is when this webinar closes, when you're finished, it should, a new browser window should pop open onto your screen with a survey, very short, asking you about this webinar. I think it's maybe got 3 or 4 questions, and probably take max 5 minutes. And so really, we would love to assess the effectiveness and usefulness of this webinar. And so if you could kindly take a couple of minutes after we're finished here today to put in your thoughts, that would be really great. We'll keep all the information confidential, and just let us know what you thought. And if you have any further questions when we're finished this, please feel free to reach out to me. My email is on the next slide.
If I can just add something as well. We designed this specifically based on our conversations with your lead, Dina, and developed this specifically to support your training, I guess, and your capacity building through your age-friendly work in Abbotsford. And so, yeah, we'll be really curious to continue this conversation with Dina and others that were involved to look at if there were some special aspects of this webinar that you would like to have some more training around, or that we could do a deeper dive specifically. I mean, again, our capacity building supports are meant to be tailored and customized to best support you. So you will be looking for, what's going to support you best for the next steps of your age-friendly planning in Abbotsford. And Sarah will be in contact to find out more about what that potentially could look like. So, potentially it could be another webinar like this, or, a variety of different supports. So, yeah, thanks so much for your time. And, thank you. So I know it's not easy work, and especially with what we're dealing with right now. So I just really thank you all for taking the time today to join us and be together to have this topic, this discussion on this topic, especially because we know older adults and homelessness right now has been amplified due to COVID. So I just really thank you for the work that you're doing and your commitment to building healthier communities in Abbotsford.